expert. October is Breast Cancer Awareness Month.
It's also a good time to get screened for breast cancer. Dr. Jacqueline Paykel from the Medical College of Wisconsin joining us live, as she does every Friday afternoon. So let's start with the basics here. Just how common do we see breast cancer in the population?
It's actually very common. 1 out of 8 women will experience breast cancer if they live to the age of 80. So we recently, we have a decline in the number of breast cancer incidences that we're seeing across the country. However, we're still seeing 250,000 cases a year.
And how much in that percentage is genetic?
A very low percentage, actually, only 5 to 10%.
So it's environmental factors are what's really playing a role here?
Yeah, genetics are very important, but environmental is very important.
So what can we do? What can women do to prevent breast cancer?
Take very good care of themselves, get their annual screenings done, or every other year. But food choices are very important, sleep, and shift workers are much more common. It's much more common in shift workers to get breast cancer.
Well, let's talk
later shift workers?
Yeah.
Let's talk about, since it's not really genetics that plays a role here, the conditions that do predispose people to being that 1 in 8.
So if you have a screening mammogram at 40 years of age, the report will say whether or not you have dense breasts. If you do, you're more likely. If you've had a breast biopsy previously, you're more likely to have breast cancer. If you haven't had a child before the age of 30, and breastfeeding is very important too.
Hormone replacement, there has been some talk about that maybe contributing?
There's a small increase with birth control pills, Depo-Provera, and hormone replacement.
Really? So you mentioned 40. Should that be the first time women think about getting mammograms? It
depends upon if they had a relative. If a relative has been stricken with the disease, they should go 10 years prior to the age of onset for that diagnosis. But otherwise, 40 is a good starting point.
All right, Dr. Paykel, thanks for joining us and talking about breast cancer in the month of October, which is Breast Cancer Awareness Month. Got a question for the experts? You can send them an email or call that number,